This is your next QD clinic, brought to you by Room Now Live, where rheumatologists can connect, learn, and interact with your peers and the faculty for 3 days. And you can actually attend the meeting in Fort Worth, or you can view it from the internet by signing in and registering, and you'll see more information about that in the next few days. So our case today is a gal named Sue. She's 35. She was seen by me about 6 weeks ago when I diagnosed her as having fibromyalgia. She presented with low back pain, fatigue, polyarthralgias, migratory arthralgias, and her evaluation has further disclosed that she does have fibromyalgia. The diagnosis of fibromyalgia is based on widespread pain, many tender points, sleep disturbance, fatigue, headaches, irritable bowel, a history of anxiety, paresthesias that are unexplained, back pain, TMJ pains, poor memory, and allergies to multiple drugs. So the plan on her was pretty straightforward. Give them something for pain, give them something for sleep, make them do the right exercise, and they come back and they're better. But guess what? Patient's not better because they didn't do what they were told to do. So the story of this case is basically less is not safer. And what do I mean by that? Well, the patient has basically taken less or not done the things that were required or prescribed at the last visit. She was given acetaminophen, 650, told to take 3 pills a day. She did that. She says it does help her substantially. She was given Xanaflex, tizanidine, for bedtime sleep and pain relief from the spasm she would get in her back. She took one, she did it for a week or two, and then stopped it because, well, she only slept for a few hours and then she was wide awake. Well, her sleep problem continues. She was given baclofen to take if her back pain got worse during the day. She never tried it. She was told that the tramadol prescription that she had, she could take on a PRN basis, never touched it, thinking can't mix tramadol with acetaminophen. Where she got that from, I don't know. And she was referred for a sleep evaluation and sleep study, never did that. So again, the patient, and I don't fault her for this, really was afraid of taking medicines, really afraid of taking more. She was afraid of doing the full regimen as was prescribed and explained to her. And in her mind, she's thinking taking less is going to be safer. So what happened here was she's worse, and we've had to reinforce her plan and restart all over again. So why do patients want to take less and do less? Number one, they don't like taking medicine. We can understand that. But mainly, many of them are of the belief that taking less medicine is going to be safer, when in fact, that's really not true. What the problem is, they don't know what they don't know, so they're left to guess that safer must be is going to be when they take less medicine. I think it's important to let the patient know that you really need to take the medicine as I'm prescribing it here at the outset, and that taking less is not a good idea. You know, for instance, I tell patients when they're on a medicine like methotrexate or even a biologic that the longer they're on it, the safer it is. And that's absolutely true, because all the toxicity with most medicines we use is front-loaded. It's going to happen when they first take the drug, the first few doses, if not the first month. After that, it's more those studies that show you, the 8-year follow-up of Enbrel. Everybody looks the same and they're all doing great. Well, that's because the drug continues to be safe and it continues to work, and it's not surprising what the results are. So again, you have to tell them that at the outset, when you're starting a treatment plan, you're going to often go in with more medicines than they want, and admittedly, maybe even more medicines than you want, because you're trying to, 1, get a better response right from the start, 2, find the drugs that work best and then cone down to the ones that they really need. So again, they have to buy into this, and you have to sort of let them know that if they continue doing what they were doing and not taking medicines or taking the wrong medicines or vitamins or whatever, they're going to get more of what they already got, which is pain and fatigue and dysfunction, etc. And that what you're also offering is a change, and a change that has been time tested and shown to work in many patients. So again, selling the idea that less is not safer, and that you really need more medicines at the outset, so you know what the right treatment is going to be is something that takes a lot of discussion, a lot of note taking. You got to write things down and then maybe even follow up on the patient to make sure you're not stuck with them coming back 6 weeks later and restarting all over again. This is one of the challenges that happens frequently in the rheumatology clinic. Tune in tomorrow for more.